I knew something was seriously wrong with me. I had a chronic health condition, and no doctor could figure out what it was. And I was searching for answers for over decades. Do you look healthy and normal on the outside to everybody else, but you wake up every morning feeling like you've been hit by a bus? And every day you are managing 5 to 10 symptoms, and no doctor truly knows what the underlying issue is. I made this video for you. You start to wonder if you're just overly sensitive. Maybe it is too much stress, like everyone is saying, and maybe everyone's assumptions about you are right. I was so unhealthy and so chronically ill. And I could do my hair and my makeup, and on the outside, I looked fine, and everyone thought I was fine, but I was not okay. Every month, I would get a new symptom, and I would be terrified. I didn't know if it was going to last a couple hours, a couple days, weeks, or worse, months. It was scary to know that I was so uncomfortable, and no one could really help me. I had these level 10 migraines that came out of nowhere, and they left me in bed for 3 days straight. I had this throbbing in my neck that was unexplainable, and my heart would race so much, and sometimes it would happen in the middle of the night and wake me up, and I legit thought I was having a heart attack. My stomach stopped working. It was clear that food just was not digesting for some reason. I got to the point where I could barely eat anything. And then there was the tingling and numbness in my extremities, my arms, my legs, my feet. It was uncomfortable, but it was more concerning than anything else. And deep down, I just knew there was something really wrong, and no doctor had truly diagnosed me properly. The truth was, I knew that all of these symptoms were connected. So I entered the medical maze, where every doctor just looked at one piece of me. I went to the neurologist. We talked about my migraines. I went to the cardiologist. We talked about my heart. I went to the chiropractor. We talked about my neck and my jaw and my ribs, how they subluxed and dislocated almost. I went to the gastroenterologist. We talked about my stomach issues, my digestive issues, GERD, and we started running a whole bunch of tests. And then I went to the ENT, more testing. I had ear fullness. I had ringing in my ears that was, of course, tinnitus. I had sinus infections, chronic sinus issues, and I had vertigo. I went to my primary care doctor to talk about the numbness and tingling that I had in my arms, my legs, and my feet. Also talked about my hair falling out in clumps and the weird red spots that I had on my hands at the time. I was probably seeing 5 to 10 doctors at any given time. Sound familiar? It was shocking to me how everybody just wanted to treat me and my individual symptoms. No one was looking at the whole picture except for me. If you stay with me thus far, thank you so much. My name is Melissa Daniels, and I am not a doctor giving medical advice. I am a wife, mother, and interior designer navigating her way through chronic illness as I have been diagnosed with Ehlers-Danlos. I created Friends with Ehlers-Danlos to help people who are also on their healing journey. So if you like the content that I'm creating, please, please, please make sure to like and subscribe, and let's get back to my story and how I hit my turning point. My story reached its turning point when one doctor finally asked a new type of question. Not, do you have migraines? How many did you have this month? Or how's your stomach today? He asked, has anyone ever evaluated you for a connective tissue disorder? So let me explain. He discovered a reverse curve starting in my neck after reviewing a recent MRI. And he said this could be caused from loose ligaments. And I asked, what in the world are loose ligaments? Doesn't that have a medical term? And he said, yes, it's called Ehlers-Danlos, but I cannot diagnose you. You would need to go to a geneticist for a proper evaluation. Now, there is a crucial point I'm going to make right now, so pay attention. There is a very common misconception about Ehlers-Danlos syndrome, that it is all about the flexibility. Ehlers-Danlos syndrome is a connective tissue disorder, and you have connective tissue throughout your entire body. This means that this illness affects the entire body, and the symptoms can and will arise everywhere. So for me, EDS wasn't the whole story. I had comorbid symptoms. So this is all the things in the body that EDS actually creates, and you can break them out into their own category. So let me explain. In simple terms, I have hypermobility Ehlers-Danlos syndrome. So this explains why my joints are weak, why my muscles can be weak, why I have joints that can sublux or dislocate in my ribs, my jaw, my neck, etc. I have POTS, postal orthotic tachycardia syndrome. This explains why I have dizzy spells, why my heart is racing, why my blood pressure is dropping. I have mast cell activation syndrome. This explains why I am reacting so strongly and sensitively to environmental triggers, food, and medications. I also have cranial cervical instability. This is explaining why I have so many neurological issues. There's an issue between the skull and the base of the neck. I have gastroparesis. So the loose ligaments are having a negative effect on the upper and lower intestines digesting food. I also have endometriosis. In this case, the connective tissues are having a negative impact on the pelvic floor and how it is functional and also structural. These weren't all random diagnoses, and all of this information just makes my head spin. So I can only imagine how you're feeling, especially if you're relating to every single thing that I am saying. All of these puzzle pieces aren't random. They're all connected to the same puzzle. And what I also really want to say right now is I am not telling you that what I have is what you have. That's not what's happening here. What's happening is I'm shining the light on how you can start getting the answers that you need to find out what is going on with you. If your body has been waving that red flag for years or months, it is time for things to change for you. It's time to start demanding real answers from your specialists and not some insignificant response to everything that you're going through and all the symptoms you have. Them handing over a medication and treating that one symptom is not enough. Someone has to be looking at the big picture. Someone has to actually care. What is the underlying issue that you have and what is causing you to go through all of this pain and suffering? My honest and sincere advice for you is do not stop advocating for yourself. Do not let those doctors gaslight you and tell you, well, you look fine. You're not fine, and you know that. And definitely keep asking the tough questions. Don't take their petty reasoning or their simplified responses as an actual answer. And keep looking for doctors who are going to feel like the right fit for you. Don't settle. As soon as you get that inkling that this doctor isn't the right one for you, move on. It took me 27 years to get a real diagnosis. And I am not suggesting that I can diagnose anybody through a YouTube video. But if sharing my story has helped you start to ask the right questions, a question with an answer that can change your life, then sharing my story is 100% worth it. I'm here to help people connect the dots when no one else has. And I'm here to help those on their healing journey. And I wish you guys all the best. Sending love and light.